This video is about the atelectasis and collapse. So atelectasis means incomplete expansion of the lungs, and collapse means collapse of the previously inflated lungs. So here the lungs are previously inflated, but in this condition, atelectasis, the lungs are previously not inflated. So it is generally seen in newborns. So whenever after their birth there is incomplete expansion of the lungs, whereas in collapse the previously inflated lungs will get collapsed. So it is generally seen in children and adults, that is collapse, and atelectasis is seen in newborn. So what are the causes for atelectasis? It is due to weak respiratory action and acute respiratory distress syndrome and premature birth are the reasons. Whereas collapse, we have three types. They are compressive, obstructive and contraction collapse. So coming to compressive collapse, which means the word suggests something is compressing by the pressure from outside. So you can see in this diagram, if there is a pleural effusion or hemothorax or pneumothorax or any tumor which is present, so it is not allowing the pulmonary parenchyma to expand here. So this type is called as compressive collapse, and in this we have examples like pleural effusion, hemothorax, pneumothorax and tumors. So it involves subpleural region mainly due to gravity. Due to gravity, normally these fluids accumulate at the bottom of the lung, so it does not allow the bottom of the lung to expand. So when you see in X-ray, what happens is, due to the pressure on the lung from this side, the mediastinum is totally some part is shifted towards the opposite side of the collapsed lung. Okay, so next we have obstructive type. Obstructive type is due to any obstruction in the bronchioles, like air is resorbed from the distal area of the obstruction, which causes the collapse. Which means when you see here, when there is an obstruction here in any part of the bronchial tree, what happens is the air which is present here is generally used up. Then next it causes the resorption of the air, so it generally pulls the parenchyma towards the obstructed part. So here there is nothing, it is empty space present. So what happens is due to obstruction there is collapse of the lung. Examples are mucus plugs that are formed in the mucus tree, pulmonary tree, like bronchial asthma, bronchitis, foreign body or bronchial tumor. We can see obstructive collapse. Next, we coming to contraction collapse. It occurs due to fibrosis of the lung. So contraction generally occurs due to fibrosis. So example, pleural fibrosis. When you see here, when there is fibrosis of the lung parenchyma, it causes contraction, and the expansion of the lung does not happen properly. So these are the three types of collapse, that is compressive, obstructive and contraction. In compressive collapse, the mediastinum is shifted towards the opposite side of the collapsed lung, whereas in obstructive collapse, what happens is there is shifting towards the collapsed lung as there is empty spaces. Okay.